Just as we've heard, my topic of presentation is healthcare waste management practices in Jalingo, a reflection of the state of the healthcare system in Taraba State, Nigeria. Summary: a strong healthcare system is known by efficiency in service delivery by its individual components. It also goes to say that poor service delivery by any of its components is a reflection of the degree of its weakness. Healthcare waste handling and disposal is as important as any other aspect of healthcare service. Neglecting this is likened unto building a beautiful house and not making provision for toilet facilities. Documented evidence also revealed that there is inadequate knowledge and poor healthcare waste management practices in Nigeria. Documented information on healthcare waste management in Taraba State is actually scanty. During the review, some of them were almost unavailable. The paper I'm presenting is describing poor waste management practices in several hospitals in Jalingo, Taraba State. The facilities were purposely selected based on the fact that most people prefer accessing healthcare services in those facilities. And the study employed WHO framework for the health system and then used that to analyze the health system vis-a-vis the healthcare waste management. The study as well reflected that the poor waste management practices observed is actually a manifestation of poor health system in the state. You can see in the next slide the WHO framework for health system in terms of its 6 building blocks. On my left side you see the building blocks, which are 6 of them: leadership and governance, healthcare financing, health workforce, medical products and technology, information and research and service delivery. While at the right hand side you see the desired goals and outcome of this framework if it is properly interrelated and practiced. The article also made very key recommendations on how to strengthen waste management and also the entire healthcare system in Taraba State. So what are the problems? Number one, past studies have shown that healthcare waste handling and disposal practices in some parts of Nigeria is in a very, very poor state, meaning that the standard waste management practices are not properly observed. According to WHO recommendation, the standard requirements include waste management plan, adequate training so that the staff will be able to have the knowledge of waste management, waste segregation, waste management material and equipment, and then waste treatment options before its final disposal in the landfills. If these very important standard requirements are not made, then it is an indication the system itself is weak. And it also has very serious implications. The implications actually are that improper waste management will result to direct hazard to the staff who are handling the waste, results to transmission and spread of infectious diseases, leads to environmental pollution, which contributes to global warming and also climate change. Documented information on waste management in Taraba State is scanty, as earlier said, and based on these problems, that was the motivation for which the study was carried out, to appraise the healthcare waste management status in Taraba State, giving it a system view and to see how it is being practiced, and if there are issues, how to make recommendations how they can be improved. The method. The approach is cross-sectional descriptive study and the sources of data or secondary sources from literature, journals, articles, program reports, And then there was also, because of scanty information on Taraba State, there was also direct observation of waste handling practices in some selected hospitals. As earlier said, the hospital was selected based on the fact that they are the ones that have high turnout of clients. There was extensive review of this literature on the subject already mentioned. And then there was also observation of waste handling practices, which took about 2 to 3 days. And during the observation, there was also interaction with the staff handling the waste in those facilities. And during the interaction, discussion were focused on their knowledge on what they do with the waste. The findings on the direct observation and the review of the literature was synthesized to write in this article, which I'm presenting with a very key recommendation on how to improve the system and the healthcare waste management. The result. The first slide you see here is a chart showing the number of hospitals engaged in a particular waste handling practice. On the nutshell, if you look at it critically, you will see on the positive side is only one best practice, which is the use of safety boxes for sharps. That was common, that was observed in all the facilities visited. But in a nutshell, to say that the standard waste management practices are not properly observed in those facilities. The reason is because only 2 of the 7 facilities visited had somewhat a written plan for waste management. Only 2 out of those 7 were practicing waste segregation, and even the one that was practicing, those 2 that were practicing waste segregation, only one of them was doing it according to WHO recommended use of color-coded bins and bin linings. There was only one that was treating its waste by incineration before its final disposal. A dumping of waste was seen in all of the facilities visited, and some of the waste were dumped in hidden corners, some were just in open places. It was also observed that in some of the facilities there was open burning of the waste in those within the facility premises. This improper waste management has great implications, and the implications include and not limited to infection transmission, which contributes to outbreak of epidemics. It leads to the individuals or the staff who are handling the waste, environmental pollution, and climate change. The review of the documents also revealed weaknesses in the health system building blocks, as described by WHO, and they are summarized here. On leadership and governance, it was revealed that there is poor leadership and coordination. On financing, is inadequate and inappropriate financial allocation to the health sector. On the health workforce, it showed that there was inadequate distribution and poorly motivated staff who are not also properly supervised. On information and research, poor record keeping was and data management is improper, data storage also improper, because most of the staff who handle record keeping were those who are not properly trained on that. On medical products and technology, obsolete and broken down equipment, poor maintenance practice, frequent stockout of essential medicines and commodities, poor logistic management. And because these 5 areas of the health system building block had this degree of weakness, it also affected the last one, which is service delivery, and that was poor service delivery, as have been shown in the poor waste management practices in the state. The next slide, you see the few of the references, the many references that were used for this study. And the next, the conclusion and the future steps. There is a typo there, the future step is in plural, the step is in plural. There are 2 concluding statements on this. The first is that waste disposal and handling practices in Taraba State is poor and needs to be improved. And how can that be improved? It is by the following recommendation. There should be a sensitization of the hospital management on the waste management, and that should be the responsibility of the relevant regulatory bodies and the departments of public health in the Ministry of Health. There should be an enforcement of the implementation of waste management plan for all hospitals, and the regulatory bodies could even include that in the requirement for registration of private hospitals. There should be training and training of staff on waste management, And there should be regular supply of waste management equipment and materials. And there should also be appropriate supervision of the staff who carry out these duties. On research, there is a recommendation that there should be a periodic assessment and evaluation of the waste management practices first by those hospitals and then by the state in order to monitor improvement. And a nationwide study is also recommended. On the second statement, concluding statement is that the health system in Taraba State is weak and needs strengthening. How can that be done? Also through the following recommendation. There is a need for strong leadership and governance, meaning that they have to start first with putting the right people in the right place, ensuring implementation of health policies and guidelines, providing good and correct coordination for the health sector. And then it should be adequate financial allocation for the health sector, which should be followed with prompt release of budgeted funds. Government and donor-funded programs should focus on health system strengthening. Most often, donor-funded programs isolate certain areas in the health sector and implement programs or projects for some few years and insist that it should be sustained by the host government, but do not actually give attention to the system. And so this is highly recommended. Adequate, equitable distribution of human resources is also recommended. In a situation where this is not feasible, the implementation of tax shifting policies should complement that. And it's also recommended that the federal government should reorganize the national health insurance scheme and make it more viable, accessible, and affordable. A research is also recommended at the national level on this. I want to say thank you very much for listening.